Santa Barbara. The Central Coast. The Santa Ynez Valley, where chaparral-covered mountains meet the Pacific, where red-tiled Spanish architecture, Victorian houses, and rustic ranch land are equally at home, where people appreciate the easygoing lifestyle and endless variety of landscape and cultural activities. Truly a very special place to live and work. More than a century has passed since 50 local women determined to bring quality health care to the growing community of Santa Barbara. Led by one woman, Mary A. Ashley, in 1888, these dreamers and achievers founded and operated Cottage Hospital, a 25-bed, gas-lit wooden structure on the outskirts of town. In that first year of operation, 52 patients were cared for in that simple wooden structure. This year, over 20,000 patients will be admitted to the not-for-profit Cottage Health system. Today, Santa Barbara Cottage Hospital is the only major trauma center between Los Angeles and the San Francisco Bay Area, committed to serve any patient in need, regardless of their ability to pay. Cottage is a premier teaching hospital with a research program, and in fact has one of the oldest surgical training programs in the state, and is only one of 3 other hospitals in the entire country in communities of our size to offer such a comprehensive range of healthcare services. Cottage Children's Hospital offers the only pediatric intensive care unit and pediatric cancer program between Los Angeles and the Bay Area. In addition to providing excellent emergency services and medical care, Cottage Health System reaches out to the community with preventative programs like the Heart Health Fair, Cancer Prevention Fair, and annual flu shots, and educational events like the Baby Fair and the weekly Cottage Health Life TV show. Cottage has become the nucleus of this region's healthcare services, with many meaningful and productive affiliations and working partnerships with other healthcare providers across the Tri-County area. Our foundation, for example, supports Santa Barbara's community clinics, making sure that everyone, including those on the economic margins, has access to medical services. The foundation also provides major support to the nursing program at Santa Barbara City College, a future source of nurses for our local community in these times of critical shortages across the nation. The area the not-for-profit Cottage Health System serves has grown from 5,000 people in 1888 to nearly 500,000 today, and it continues to grow. To accommodate this growth, Cottage has matured into one of the largest employers in the region. Yes, a lot has changed since those early beginnings, but some things remain the same. The indomitable spirit of caring and innovation first started in 1888, and our commitment to the healthcare needs of our community. Prompted by Senate Bill 1953, which set rigorous seismic upgrading deadlines for all acute care hospitals in California, and after a thorough evaluation of the ever-increasing demands on our facility, it became clear that a rebuilding of Santa Barbara Cottage Hospital was not only necessary, but the right thing to do. The Cottage staff has studied the best models of new hospitals across the country, consulted with experts in the field, as well as people in the neighborhood, in order to develop a premier hospital of the future, a hospital, a place of healing that our patients can be confident in and our community proud of, a place where high tech and high touch meet. A 337-bed, all-private room medical center that will give patients the privacy they want and deserve. A comforting, supportive environment for family members, including a spiritual center. And during the rebuilding, at no time will there be fewer available beds than there are today. Cottage founders envisioned a group of cottage-like buildings where patients could heal in an intimate and comfortable setting. The replacement hospital project will fulfill this vision by building low-rise cottage-like pavilions, reflecting the aesthetics of the Spanish colonial revival architectural style this area is so well known for, with landscaped courtyards and grounds. The hospital will be enhanced with a modern glass entry and natural sunlit walkways. Furnishings and decor will feature warm tones and a feel for Santa Barbara and its natural beauty and grace, while also helping to reduce patient stress. There will be meditation areas in the gardens. A stream will wind its way through the facility, blending nature with technology. New robotics, communications, and imaging technologies will allow for rapid diagnoses, timely procedures, current and complete information that will enable physicians and staff to treat patients more effectively. And with the doubling in size of the emergency department and Level 2 trauma center served by helicopter and ground rescue teams, the entire region can put its trust in Cottage Health System. The members of the Cottage family feel privileged to serve our community and are aware of the extremely significant responsibility that lies on our shoulders as the only remaining acute care hospital in Santa Barbara, and we will work all hours of the day and night, 365 days a year, to ensure that the legacy of care continues, for now and for the generations to come. But we need your help. We are every day given the opportunity to do good things and the choice to do exceptional things. Something that will be remembered, something that will ensure the well-being and prosperity of our community for generations to come. This is a very special place that we are fortunate enough to call home, a place that's world-class.